I'm Dr. Rick Buck, and I've been a dentist for 18 years. A few weeks ago, I had a patient come in wanting a procedure that a lot of you have been asking about. So here it is.
And so what we're going to be doing is taking this beautiful smile and we're going to be adding gems like this. What I want to do at the beginning is plan everything out. So I look at her teeth, I kind of plan where I want them to go with her input. She doesn't care, so I get to decide where they go. And what I do now is I just take my drill and I roughen up the surface. That's going to make this have a really good bond, and then I etch that surface. And once I'm done etching the surface, I clean it all off. I air dry it off, and when I air dry it off, you can see a frosty look appear on it. And that frost lets me know that we are ready to put on the gems. So to start that, I take a little bit of the bond that I have and I just dab it on the tooth, and then I dab some on the back of the gem, and then I apply that gem to the tooth. Now, until I cure this, I can kind of just set it on the tooth and I can move the gem around a little bit. You have to be very careful to make sure this doesn't fly away or the patient swallow it or get lost on the carpet or anything like that. But you can see I can just kind of move it and dab it and push it and maneuver it until I find where I want it to go. And then I put another dab on for another gem that I'm going to put on the same exact tooth. And you want to put it on the back side, and then here I am. I'm just adding it to the tooth in a vertical motion. Since it's not set, I can just kind of push it around until I find the exact spot I want to go. I do have to hurry a little bit because this will set up on its own. And then once I do, I set it into place with the light cure. Now this isn't all I need to do for it. I will need to add some more, you'll see in just a second, but this gets the initial cure so I can't push it around or move it anymore when I find where it wants to go. But this by itself isn't strong enough to hold it into place long term. It just kind of gets it there. So now I take some more bond and I add it around the edges of the gems. And I just kind of add it around so a little bit goes up the outer edge, and this will secure it into place. Now, these are made by a company called Ivoclar, and Ivoclar is a very reputable dental product company that us dentists use a lot. So they recommend putting the bond all the way on top of the gems, but I don't want to do that because I think it will take away from the luster, even though they say it won't. So I just add it to the edges, which is the second best thing they recommend, and that sets it into place. So now I can push on them, I can do whatever I want, and these things are not going to move, they're not going to budge. It will take a lot of force to remove these. These are really well bonded into place, and I'll tell you why in a little bit. But that's how you get the first set on, and I decided to put these ones vertically. I decided vertically because she had some before and she kind of liked that look, so I went with that.
Before I get to the most mind-blowing part, you need to watch my video on how to get your teeth stunningly white, or my video on the best way to brush, floss, and take care of your teeth to avoid bad breath, cavities, and gum disease, linked to at the end of this video. And all the best products, which are my products from those videos that will get you those incredible results, are linked to below in the description of this video.
So now I'm starting on the other side, and as you can see, I'm just roughening up the other surface. But as I'm doing everything, you're gonna see it's all pretty much the same, and I'm just gonna, instead, you can watch it and tell you a little more about these. So these are from Ivoclar, they're called Skice. And what they are is they're high quality crystal glass. They are not diamonds, they're high quality crystal glass, and they're available in 1.9 millimeters and 2.4 millimeters. And the gems, they're coated on the backside with aluminum oxide grit and with a brass center to ensure that they're going to get a really secure bond to the tooth. And so that's why they're different. So if these were diamonds, you would need to pretty much cover the whole thing and hope for the best, and I don't recommend that, obviously, but these are specifically made so that they bond with the bond to the tooth. Now this bond is called Helio Bond. I believe it's also by Ivoclar, and it's the bond that they recommend to use. I'm pretty sure you can use just about any bond. I just went with the one that they recommended because I figured it would be the most clear and the one that gets the best bond for their product, probably, but I don't even know that. Now what's cool about that these are made by Ivoclar is they are a dental company, and they make high quality filling material, they make high quality everything. So you may have seen some of my other videos where I do composite veneers. They make some of that cosmetic composite that I use for composite veneers. So they're the same company, very reputable, very high quality, And so you can ensure that these are going to be done right and with good material if you have them done by a dentist office that uses these. Now, you're going to end up paying a little bit more for them having them done at a dentist office because these aren't cheap to the dentist, and therefore the cost gets passed on to the patient as well. But they are done right. Now, you may be wondering why I put them where I did. So when you do cosmetics and anything in cosmetics, what I aim for is balance but asymmetry. So I put 2 on one tooth in a vertical manner, and then I want to balance it with 2 on the other side, but then I put them on 2 different teeth in a horizontal fashion. And so we have both balance and asymmetry. When the patient goes to the bathroom and sees what I did, she loves it. She tells me she's so excited about what they are. And I'm excited too. I'm excited whenever they're excited, but that's what I go for when I do these. Some patients will come in knowing exactly what they want, and if they do, that's great. If they don't, this is what I aim for: balance and asymmetry. But here you can see these are on there good. If you want to remove them as a dentist, you can use a ortho band remover, and these will pop right off. Other than that, it's going to take a lot of force to get these off of the tooth. They bond on as you would bond a bracket for braces, and that obviously takes a lot of force to remove them. So here's the final result. The patient's super happy. So the patient obviously didn't need this done. It might be controversial for some dentists to do it. I figure as long as they're going to be having these done, they might as well have them done professionally in an office where they know what to do if something goes wrong, and nothing is likely to go wrong with these anyway. But if there were, they are in an office that knows what to do.
If you want fresh breath, really white teeth free from cavities and gum disease, watch my videos linked to now or click on the links below for my best products. If you want to schedule a virtual consultation because you're interested in composite veneers, schedule it from one of those links below. If in Southern California and want a dentist, my office is also linked to below. I do implants, all-on-4 dentures, cosmetics, and everything else.